plenty of followers that probably want to hear a lot of what she has to say. So
I also follow you too. Yeah, we in there? It's another beautiful Sunday.
You couldn't wait, could you?
No.
Ding, ding.
It's another beautiful Sunday here in Reno, Nevada. We're actually in Sparks. I'm here with Dr. Cari, for fuck's sakes, for another podcast. Music's fire.
Yeah, it is. We had kind of a rough month. Jeffrey and I were sick, and then we were kind of getting a little bit better, and then Jeff went to a wedding, so we've had a month off. So I haven't seen the guys for a little bit. Oh yeah, and then the holiday, of course. The bird. The pilgrims.
Today we're talking health insurance.
Because everybody's talking about that right now.
This is the thing.
All fucked up.
So where do we start? Where did health insurance start, first and foremost? Like, how did this system start in this country?
So interestingly, before the 1940s, there was no such thing as health insurance. So those who could afford it just paid, price per fee directly to the physicians or the facilities. And if you didn't have the money to do that, then you went to almshouses, which were driven by charity. They were covered by nuns and civilian physicians, basically, who were volunteering their time. And so it was a little hit or miss what you're going to have going on there, but there was no such thing as insurance. And then we got into the World Wars, and the federal government had wartime wage caps because a lot of the money was going towards the wars. And so employers were only allowed to offer their employees a certain amount of money. So if you wanted to make your job a little more lucrative and lure in higher people, then you offered them benefits, because that didn't go towards the wages, right? It was kind of, that was the loophole, essentially. So that's how health insurance started. And that's how it got linked to your employer. Most countries don't do it like that. Like, even if you have health insurance, it's not through your employer, but that's the way we decided to do it in the 1940s. And that worked for a while because it was fairly efficient and there wasn't a ton of greed about it. It was more about actual healthcare and patient care and wellness. And we have gotten completely away from that because greedy people realized that it was a huge moneymaker, and you could get CEOs to have like $40 million annual raises and shit like that. And so that's when patient care and wellness and the patient-physician relationship went in the tank, because then it became all about money. And in the last 30 years, our premiums have gone up substantially. What is covered has gone down substantially. Nobody is happy. The barriers to health are high for everybody who can't afford to basically pay cash. And so the benefits they friggin' suck. I think those of you who are insured can agree. Like, if you're over the age of 40, you know how it used to be and you know how it is now. And frankly, it's terrible. And there's just a very few people who are getting super wealthy off of it. And the outcomes of healthcare are just getting worse and worse. Like, the US has never rated so low in morbidity and mortality. And so that's where we're at. Like, nobody is happy. Providers aren't happy. Patients aren't happy. The only people who are happy are the insurers and the pharmaceutical companies that are making billions off of a system that's going in the shitter.
I will agree.
Yeah.
I would totally agree. I don't know if I've said this before, but I have a company called Maxor Plus. I just want to put you guys on notice. It is the shittiest prescription company on the planet, to the point where I don't even use them. I don't think anybody uses them. Anyone who has county health insurance here in Nevada, nobody probably goes and uses this company, because it's a 90-day service where they refill a 90-day supply. But at the same time, there's always some kind of fuckery with these guys. You call them, and I tell you about the lady who quit.
Yes.
Right?
Yeah.
She was just so fucking
I've
upset.
had enough.
Yeah, she had enough. Jeffrey, hit me.
Thank you for calling Premium Health Insurance, where we decide what's right for you. Is there a reason I can't get my medications this month? Have you tried asking your doctor what you need? Where do you think the prescription came from? Do you practice medicine? No, sir, I do not practice medicine, but you can't have this medication. What should I do then? I suggest you ask your doctor what you need. What do you think I'm doing? He says I need it. You're the one that says I don't. I understand that, but you can't have it. So you basically decide what I can and cannot have. No, we just decide what we will and will not pay for. So I pay you every month for you to decide what I can and cannot have based on what my doctor thinks that I should have. Basically. And if you don't think I need it, you just refuse to pay for it? Well, you could always pay the $976 monthly fees out of pocket if you want. Okay,
Crazy.
so
That's
you
real.
do practice medicine. Yeah, but we're not allowed to say that legally.
Fuck them. Shout out to everybody on TikTok. Now listen, how does insurance work here in America? Because I want to talk about some free universal health care. How does it work in this country?
Mm-hmm. So
shout out to you, Bennett Marsh. Thank you.
Thanks, Mel. So the way it's supposed to work is that you pay monthly premiums. They have usually a copay just to give you a little skin in the game so that you're not visiting the urgent care ER, your primary care. You're not visiting those people willy-nilly. You get a little skin in the game, right? And then insurance should kick in and pay for the rest of the stuff, at least to a certain extent, if not like a significant percentage. And then on top of that, you have a deductible, which could be thousands and thousands of dollars, right? And so oftentimes, like, say you have a $1,000 per month premium for you and your family, which would be really low. I don't know what year that's from, but let's do the math. So then you have like $12,000 that you need to pay per year for your insurance premium. And remember, you have to have insurance legally, IRS. That's how they track your ass. And so then you have a deductible, which might be $8,000. And so you have to plan every year to have 20 grand just sitting around in case someone breaks their shit, has an appendicitis, has a heart attack, like whatever is going to happen to you that you cannot see coming. And then maybe if you're lucky, you have an HSA or FSA plan, which is tax deductible, which means you can go in pre-tax money, and per family, I think it's right around $8,500 that you can put away for that. And then you can use for expenses later. that feels good,
I
but
agree,
it's
Michael.
your fucking money.
I agree, Michael. I agree. We need universal health care.
Get a hold of the materials because there's Medicare.
It is taking advantage of Medicare.
And the FCL turned around and provider claimed.
Yeah.
Provider submitted.
That sounds right.
Patients were being held financially responsible. Thousands of dollars of services they received.
Yeah, and I'm sure that FCL is not the only scam company around there. But going back to that's what the healthcare system and insurance companies are supposed to be doing, which already does not make a whole lot of sense, right? Like, that's a ridiculous amount of money to pay every month. And then you still have a deductible, meaning until you reach those thousands of dollars, your insurance doesn't kick in. Now, your insurance is supposed to have contracts with providers and pharmaceutical companies and labs and diagnostic centers. So say an x-ray is supposed to be $150 if you're cash pay. Then your insurance company is supposed to go in and say, hey, these are my people. We're only going to charge them $95. Okay, so that's what's supposed to happen. But I will tell you that is frequently what does not happen. And so say the x-ray is $250 and your insurance hasn't had a conversation with that diagnostic center in 8 years or has a fucked up contract that they decided on and inked on. And so instead of you paying like $250 cash, you're actually going to pay $325 through your insurance because they haven't contracted properly or have not renegotiated. And so sometimes you get screwed by using your insurance and it's cheaper to pay cash,
this is crazy
right?
shit.
And then if you pay cash, you decide, I don't have the $325. I'm going to pay the $250. The insurance doesn't even acknowledge that you've really done that for your out-of-pocket fees. What is actually happening here? And so, like, my physical therapist and I, she's one of my best friends. We have very frank conversations about this.
D?
Yes.
Okay.
And she's a book club right now. So why she's not with us.
Number love for D. We love you, girl.
That's right. Battleborn Health. Whoop, whoop. So my insurance has not spoken to her for ages, for years. And price fluctuations have happened, right? It is cheaper for me to pay out of pocket to see her so that she at least gets $100 per hour. Because otherwise, if I use my insurance, she gets paid
crazy.
$55.
Can we put Michael up real quick? Put Michael's last comment up real quick.
Single payer. Oh, yeah. We do. We spend way more in healthcare than any industrialized nation by like 25 to 35%. And we have the worst outcomes. And that gap has gotten bigger and bigger since 1990. Like, look at any research. It's
Give me
true.
something, Jeffrey. What you got, baby?
Decide the medical care you get, the doctor or the insurance company.
Cigna, what can I do for you today?
Recently, an insurance company was sued for causing claims to be denied without even looking at the medical chart, at least not having a physician review the medical
Cigna.
chart. The defense was technology used to automatically deny these claims.
Yes.
Look, there's a lot of roles for technology in healthcare, but interfering with patient care is not one of them. I'm not here to bash insurance companies. I'm here to treat patients, but we have to do better, all of us.
Yes.
Once again, I'll give you that.
A lot of it is a technological issue, meaning like you're dealing with an algorithm and a system. You're not even dealing with people looking at it saying,
That's right.
It's triggering technology, right? So
It is now, but that doesn't explain the last 20 years leading up to this, right? Like, yeah. So that's been a thing. If you don't meet the algorithm, then the algorithm just kicks you out with a no.
this guy has some.
One second. Before we run this video, shout out to everybody who's in the room. We got some great numbers. Yo, definitely subscribe to Dr. Cari, for fuck's sakes, on YouTube, her Instagram, and her Facebook. Thank you guys for being in the room. We appreciate you.
Websites attached.
100%.
That's right.
And her telehealth. If you guys need any health care, this is a woman to do it and put it down. She's the hormone hero. We appreciate Dr. Cari. Let's go.
Yep. If you want an example of the ridiculousness of health insurance in America, I just got a prior authorization request and a medication change request for a patient whom I had sent in clobetasol cream for. It's a strong topical steroid that we use for certain rashes. Their preferred alternative that they want us to authorize is, wait for it, clobetasol cream. So this is just going through a computer system, and for whatever reason, it doesn't want us to prescribe clobetasol cream, but the alternative that they recommend is clobetasol cream. So this just means that we have to spend more time on the phone working with the insurance company to get them to just send in the thing that they told us we could send in that we already prescribed.
Yo, wait a minute. Let me ask you a question before you get going. First of all, get Sue up. Put Sue up.
Oh yeah, insurance.
Hey, Sue.
Love you, Sue.
We love you, Sue.
And you should be insured, and I will always take care of you. But $32,000 per year for a family of 4, very healthy family, because they are small business owners.
Transfer of wealth.
Yes.
Fuck.
Huge. Like, how are you as a business owner, as a middle class employee? Yes, you cannot get ahead. There's a reason why this system is in place. It is to keep the rest of us down.
I heard something about, like, I don't know what percentage, but a big percentage of families and households are like one big medical.
Shit.
Over a quarter of our population are one medical emergency away from being bankrupt. Yeah, it might not be your fault. That's right. Like,
and get bit by a spider and it's fucked, huh?
A spider.
I mean, I'm in, like, in North Carolina, like, you know, a tick or some shit can fucking take you down.
Tick bite, and all of a sudden you've got Lyme's disease, and you have tens of thousands to hundreds of thousands.
Life has changed at that point, huh?
That is how you get unhoused. That is how you end up on SNAP, which we, by the way, just did away with for 6 weeks. And those people are still trying to get their checks. Like, it is, and it just goes on and on. But I think what I want to really emphasize is that the healthcare disparities in this country, like, the problem is empathy. Like, somehow we don't feel like this is a community effort. And what I think people don't understand when they say, pull yourself up by your own bootstraps, get a job, work harder, all these other things, is if you're the person saying that, your life gets suckier if your neighbors and community members are not doing well. We all have to help each other do better so that we can do better. Like, if you want to be self-centered and want to be all self-absorbed, help the people around you to do better and feel better and be more productive and be wealthier and healthier and happier. Crime goes down. Like, people are not dying. There's not needles in the street. People aren't shitting in doorways. Like, can we please understand that your quality of life improves if you help the people around you to have a better quality of life? Empathy, kindness. Oh my gosh. And industrialized nations, like Michael was saying, we are the worst at having social support for people around us. And all you have to do is, like, take a little bit of the froth off of your coffee and hand it to other people, and everybody gets better.
I think this is a take and 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 take business, right?
Yes.
Luigi, unfortunately, was very, he was upset. My plan through employer is about 25% of my annual gross. That is freaking crazy.
And Craig has been with his employer for 30 years.
Shit.
30 years.
Oh, that's terrible.
Why in the world? So your house is supposed to cost about 33% of your income, right? So then you add 25% of your income to health insurance. So you can't get sick, and you better not fuck up your house. Like, it just 20 years he's been there.
Shit.
I thought we were older than that, Craig.
Salute
Sorry.
to you, Craig. Love, boy, love. Number love.
I mean, what's left? Like, you don't have any clothes, you don't have any gas, you don't have any food, you haven't done any self-care, you haven't paid for daycare, you haven't paid for education, you haven't done any of that. And half of your income is already gone just with that. And you might not even use it. That's the thing. Like, why are we paying so much into a system where we may not even use it, and it's still not being used for our community? It's still not being used for the general society. It is going into bonuses for CEOs.
And they're making a shit ton of fucking money.
Who have mansions and like 17 houses across the planet and go into the office like quarterly. Fuck you. Like, what are we doing?
I agree. Fuck y'all. Now, let me ask you this, Cari. Why is the Obamacare so hated on? And how can we improve that? And where do we go from there? Like, because I don't know anything. My wife, thank God, she looks at the, the plans and the whole nine at the beginning of the year and what's best for us and the whole nine. But why is Obamacare, and by this administration, is hated? Seriously.
Because it was labeled politically as Obamacare. It's not. It's the Affordable Care Act, right? And right. So that is 90% of it right there, because the same people, y'all know who you are. Oh
man,
I would take it all for the team. I would lay myself down.
They say he smelled like Oreo cookies. That's what they say.
Oh my God, I miss him so much.
He was amazing.
Oh.
Yo, I love Obama, dog. Sweet.
So yes, the number 1, 2, 3, and 4 reason is because they called it Obamacare in order to politicize it and polarize the whole thing, right? It is the Affordable Care Act. It's the ACA. And the ACA is basically extending a Medicare-like policy to the rest of us who aren't covered by our employers, or we can do better on the exchange. The problem with it is, and by the way, like, if you ask people in general, not about Obamacare or the Affordable Care Act, so that it's not politicized, if you ask them specifically, do you feel like kids should be insured until they're 26? 90% of the population says yes. That's the Affordable Care Act, assholes. You just don't know what you voted for. If you ask them, like, hey, if you get into a catastrophic situation, do you think that insurance should kick in, even if you didn't have insurance before your ass got run over by the car? Do you think that insurance should kick in afterwards so that the rest of us are able to help you recover? 90% of the population says yes. Like, almost everybody agrees on the topics that are the basis of the Affordable Care Act across the board, except like 10% of the people who nobody wants to talk to. So hold
on. So are we fucking with it just because it's called Obamacare?
Yes.
We're just mad because this shit's called Obamacare.
Yes. Of course. They politicized it because Obama was in the White House and both houses of Congress were owned by the Democrats for a very brief moment in time where they were able to slide this forward. So the Republicans were super pissed off about it.
That hurts my heart. No bullshit. That fucking hurts my heart, bro. I think both names offend the rich. Obamacare and Affordable fucking Care Act. The two things that they both hate.
Because they don't want to share. And they feel like it's sharing, and they feel like it's socialism, and they feel like it's all these supposedly bad words.
At some point, someone in the upper echelon of power saw money.
It was all greed. It was greed.
Because I never understood why is health insurance, I can go shop. Home insurance, rental insurance, I can shop around for all these other insurances.
Yeah, like, why don't we get that through Geico?
You know what's really crazy here is the fact that, even with the Obama phones, they cut that program.
Mm-hmm.
They cut the Obama phone program. I know that for a fact that they have cut that program. And it's like, you're helping people. And it's like, we don't want to help any fucking body.
Right.
My wife brings up
Yes. So before the ACA,
Caitlin, what up?
yes,
Love you.
pre-existing conditions was a big problem with a lot of different healthcare, health insurances. And so like if you went in and you had diabetes, high blood pressure, you'd had a little stroke, you know, any of those things that are like considered a chronic condition that you may have to get treated for the foreseeable future, insurance companies could just not insure you. They could just say, oh, you had the thing.
No, thank you.
We don't have to give you anything.
Damn.
Right? And so people just went bankrupt. And so that was another thing that the Affordable Care Act said, we're not doing that anymore. You can come in with whatever baggage you have and everybody has to pay for it. And it is truly kind of a socialized medical care system in that like those people who don't have a lot of medical problems are paying for the people who do have a lot of medical problems.
And that's the system?
That is the system. But here's the thing. Those people who do not have very big medical problems and big medical expenses are going to at some point, right? So this is just like Social Security. This is just like Medicare, which the Republicans freaking love, by the way, and that's all socialized. It's all socialized because the people who are younger and making more money and aren't eking off the system because they are younger and more vibrant and
Bernie
usually
Sanders.
healthier.
We should have got Bernie Sanders.
Yes, they're paying for the old people, but we're going to be old too, and so you're going to need it.
Damn.
Yes, Angela, if we each pay a little, we all get a lot. And even if you're not getting it right now, if your neighbors are doing better, so are you. So I cannot understand it. Here's the other thing. The ACA, because it is kind of going in the toilet right now, I think, like, especially this year as it's open enrollment and people are finding out on the exchange that everything's going up and nothing's being paid for and all this stuff. The ACA is not Medicare. It is a collaboration of local and private insurance companies, federalized stuff, a little bit of Medicaid, some Medi-Cal, like it's this hodgepodge of things that are all failing because of the entire system, right? And so that's why the ACA looks so crappy right now, is because everything's kind of failing and the ACA is the umbrella under which all of those things are. And so now that the GOP is like, oh, Obamacare is shit and haven't you noticed all your premiums going up and it doesn't cover anything and blah, blah, blah. All the insurance companies
Everything is fine.
That.
Everything is fine. This is the best it's ever been. This is the best it's ever been, Cari. You're wrong. You're fake news.
Don't make me punch you. I can't.
All right. Okay. All right.
Is that she has asthma. Her Walgreens oftentimes go out without have to go in for another asthma test just to get more prescriptions.
Fuck. It's a hustle.
Yes.
And insurance is saying this.
Insurance is saying you have to go back in to get another asthma test to refill your inhaler.
I have to do another test. I've done a million.
And that seems like such a waste, right? Like if your disease is stable and you're on the same medication and nothing has changed, and excuse me, like the algorithm can't pick up on that, like computers can't understand that, oh, well, they haven't been in the hospital and they haven't had any extra doctor's visits that we've paid for. So it looks like everything is okay. So just give them the same damn meds.
Oh, no, hold on. Hey, listen, everybody who's in the room on TikTok, the full show's on YouTube. Please go to our YouTube channel, subscribe to Dr. Cari for fuck's sakes, FFS for Dr. Cari. I want to ask you this question. What is the sentiment of doctors across the board? Are there doctors that are like, fuck it, let's take? Are there doctors like, let's care? What do you feel like the sentiment of doctors is right now in this climate?
I mean, the people that I'm talking to most are in the emergency department, right? So we have a fairly skewed view of things because our profession has changed enormously over the last 25 to 30 years because nobody has a primary care provider. They can't get in to see specialists. They can't get any of the tests done in a timely fashion. And so people just be showing up like, I haven't had my prescriptions for 9 months and now I'm dying.
I want to keep Angela up. I want to keep Angela's post up. I just want people to see what she said. Okay? Medical debt is such a uniquely shitty American thing. Leave that there until we get another comment. Leave it right there. Go ahead. I'm sorry, Cari.
Angela, you are 100% correct. 100%. I don't know what our problem is with this, but I think it's greed. I think it has become the easiest way to make money off of people suffering, which is absolutely fucking disgusting.
Now, let me ask you this. Do you guys get into this profession to care? Is it what? Let me ask you, is it about money for you, for doctors as a whole, or is it about care? Because you guys went through a fucking whole lot of shit to become doctors. So what's the deal?
Yeah, so the interesting thing about that is that I think the general population thinks doctors are rich, and so that's why they don't care about anybody, right? Right?
Wrong.
It kind of looks like that from the outside.
A little bit, a lot of it.
Very superficial.
Very superficial.
For sure.
So, I mean, I would distill it down into this. Like, most people are going to med school in their early 20s. It takes us about 10 years to get through everything.
All of it.
All of it. Well, after undergrad, like you have to do undergrad, however that long lasts, like
you go
4 to 6 years.
You go 4 years undergrad. Now, next step, boom.
4 years of med school, minimum. And then at least 3, but usually 4 to 5 years of residency, if not longer. Okay. So you were a kid, you didn't make any money. You went to college, you're probably already in a little bit of debt, right? You go to med school, you rack up 6 figures of debt. Okay. So you've already bought a small house and you have made no money. Other people who either didn't go to college or got out of college and started working have an income at this point. You do not, as a physician.
Undergrad graduates, you're saying? The regular people who graduated 4 years is what you're saying?
Yes.
All right, cool.
But if you're in med school, you are racking up 6 figures of debt. You are not making any money. Zero.
It is one of the occupations that makes both ends of the spectrum. Oh, you guys are rich, you don't care. Oh, fuck that. You guys got crazy medical bills or crazy school bills.
School bills.
Okay.
Yeah.
So there's a sacrifice involved.
So then you get into residency and you make about $34,000 a year, working about 100 hours a week. What? Do the math on that. You're below the poverty level, but you have like 2.5 full-time jobs.
In status a little bit because you...
And you still have not paid one single dollar towards your 6 figures of debt. Okay, so the interest is just racking up because you still haven't paid anything.
So you guys are living in real time. Like you guys are living in a real, like you guys are in the struggle for real at this point.
Oh, people were sleeping in each other's laundry rooms. Let me be clear. Like this was not cute. This was not a cute time. This was like an extended college situation where you had multiple roommates. People are fighting over spitting in the sink. You know, like it was terrible. Plus paying rent, you need, roommates to afford to live, all of that stuff. And so...
Way to go. We let you eat. Going through the VA is a pain. Disability and healthcare. Yeah. Wow.
I've always wanted to ask Republicans. Is you are pro-military troops.
But you don't take care of these guys.
How is that not the best of the best?
Right.
That's how you're...
The VA should absolutely be the top-notch medical care. And it's socialized. So I don't know what y'all are talking about.
This is a veteran saying going through the VA is a pain for disability and healthcare. That's crazy.
It is. Fuck. The VA is a socialized system. And you know what we get out of it? We get some of the best healthcare statistics, some of the best research and development, some of the best information that we base all of the rest of healthcare on comes out of the VA system. Why is that? Because it's socialized. Because we can access it. It's a whole system with like tons of people who basically are at the mercy of the system, for better or for worse, that you can send questionnaires to. You have to have these tests. We're going to give these medications to you and see what happens. Like, that is where research and development all got started, was in the military and continued in the VA. And all of that is socialized medicine. And if that doesn't scream Republican, what? I'm sorry.
That's actually really.
Yes.
It is ironic.
The irony is really gross,
sure.
actually. Like, you guys don't even know what you're talking about.
My house is okay. Everyone, you make your own choices. Don't. Shout out to your wife. Whole different.
Yeah. My wife is the same way. So,
Dude, the lone wolf does not work. That's not how our society works.
My mom, her boyfriend, great people.
your mom's boyfriend was in the military at the time.
And he was really long time, really good. Remember after George Bush, he sit on the couch, made me watch it.
Right?
George Bush speech that you were watching. Mm-hmm.
And at the end of it, they both stood up and started
Clapping
clapping.
at the TV after George Bush's
And I'm
statement.
like, this, we're not there. I can't be in there clapping. Sure. It was just so wild to say. So I'm kind of
Patriotism.
I think
Or drinking the juice.
shitting
depending
on Americans is a terrible thing.
Funny. Being older.
Open up your eyes, huh? Yeah.
Understanding. I felt like I've always had.
Shout out to Kaylin, man, for helping this fool out. I love him, but that's just, yeah. Shout out to Kaylin. We love you, girl. Listen, I want to ask you this. Hey, yo, Cadell, what up, boy? I love you. I know you can't hear that, but that's for you, Cadell. All right, I want to ask you this. I want to ask you exactly how does this universal thing work in other countries? And we refuse to accept the same thing here because of the money grab, of course, right?
Yeah.
I do want to ask.
Yeah. Yeah.
Oh, for sure.
And every single one that you.
For sure.
No.
When you can go over to Turkey and Mexico and get certain procedures done for
Because
nothing.
But they say the bad part about it. All this, all that. In terms of if you want to get any medical done.
So yeah, the rumor, and some of it is true, yes, that in universal healthcare systems, you end up having to wait for non-emergent procedures, right? So you need a new hip, you might wait 6 months to get a new hip. Versus here,
You pay for a new hip. And you pay
it depends.
full amount, right?
Middle of the road, you're still probably going to wait a couple months, and that is very much determined by where you live geographically, what your insurance is. I would
National
still
average?
say
National average?
I would still say like 8 to 12 weeks. If you need a new
8 to 12 weeks. Okay.
So-
All right.
half. I would say
All right.
about half.
I mean, that could be a lot to someone.
It could be a lot to somebody. It could be a lot of pain. You might be quite disabled, like you might have trouble
Put E
getting
up,
to
put
work
E up.
and things like that. So you can have medical paperwork and still get denied. Been fighting for almost 20 years with the VA math for disability. Eric,
And these people
That is
served us. They served our country.
tragic.
Yeah, it is.
and you are not alone.
Put Craig up.
And that's not a good thing. Like, I'm sorry to say that, but I mean, we hear that all the time. Hear that all the
Put
all the
Craig
time.
up.
What happens anyway?
What are you saying, Eric? What are you saying, Craig? What happens anyway?
So I do have to say, with universal healthcare, a bunch of different countries have been doing it for decades,
Oh, the
right?
time period. I think that's what you're talking about. The time period. Go ahead. I'm sorry.
And a lot of them do it in different. The wait happens anyway. Yeah,
Yeah, wait,
absolutely.
Yeah.
especially if you do not have good coverage, you don't know how to work the system, which is a disaster. You don't have an in, all those things. Like, there's a lot of different factors
Gotcha,
whereby people, and the other thing is, like, people are hopeless. And so they sit and they don't do anything. They're like, my shit hurts, but I don't even know where to go because I can't make, I don't know who I'm supposed to see, who's in my network, who is actually a good surgeon, who, like, they have
and listen,
14 questions and they just sit there because there's nowhere to even get started.
They want answers.
They
fast.
do. Yes. But they don't even know where to go because they probably don't have a primary care provider, or it's going to take you 3 to 8 weeks to see your primary care provider. And then they're going to say, oh, I have this great orthopedic surgeon, and they make a referral to that surgeon. The surgeon doesn't take your insurance. And so it takes you 3 weeks to figure that out. And like, it just keeps going and people just give up because maneuvering the system is freaking ridiculous. I'm inside the system and I have been inside my local system for 25 years. It is still a bitch to navigate. And so how do people outside the system who aren't in medical care, who don't have relatives and friends in Medicare, how do they do it? They sit on the couch and get worse and are stressed out.
Louder, Jeffrey, louder.
You have to pay here. Free in other countries, you have to pay for it in other countries.
Right.
Some of them.
Right.
We'll get to that, yeah.
So it's coming out of your taxes. Say either you're paying for it or you tax. Rather pay for it tax, pay for it medical. Taxes sounds a whole lot better now, but going back to the rich, that taxes are going to get them rich.
Well,
The other side gets them rich. They will never want it to come out of
They will never want that.
Benefit.
That's right.
So
There's no incentive for rich people.
Explain what he's asking, Cari. Just
There's no
elaborate
incentive for wealthy people to help others with healthcare through taxes, especially because if you have millions and millions and millions of dollars, presumably you are also supposed to pay a few $1 million in taxes.
Yeah.
Let's not get into the loopholes where that's not even fucking happening. Right? And so they're trying to get rid of that. Fun. But they can just pay cash for it. And it doesn't behoove them to be part of the community to improve the wellness and health of other people. And they are the ones pushing the buttons. They're the wizard behind the curtain, right? And so no wonder it never goes anywhere. Oh yeah, 4 to 5 months for a dermatology appointment. Standard.
4 to 5 fucking months?
Oh yeah. Like Sue, who was just on here, total HIPAA violation. I referred her to somebody 6 months ago. She just saw them like last week. And this, like, what in the hell? Like, you know who you're supposed to see. You've already had the studies done. She's like, I'm going to see them in November. I'm like, it's August, friend. Why are you seeing somebody in November? And then she got put off to December anyways. Like, it was crazy.
Bringing socialized healthcare in America, fringe on America, building what you build.
So, like, do doctors not want socialized medicine because it infringes upon our ability to make more money?
That's a good question.
Or the origin.
You heard them. What say you, lady?
The origin of it was that was a pretty big.
What say you?
If you were medicine back a long time ago, pretty important.
Yes.
So like that built off American dream of coming over here and building New York.
It was a lot more respectable back in the day. And I think part of that is the fact that the whole system is so jacked up. Like, doctors go down with the boat and like, we have not stopped it. So that's on us. Thank you, AMA.
Give me Battleborn Health up in there.
So
how does that work?
They do well. Like, they are definitely, they may not be yachting around. No, they don't get kickbacks on the taxes, but
so let me ask you this.
Things are easier though, and overhead is so much less.
Let's explain this first of all.
Yeah.
Like, so What Jeffrey's asking is that through universal health care in other countries that come from taxes, correct?
No, not necessarily.
Okay.
There are
Make sure we explain
countries,
it.
yeah. So there are countries that do that. They tax their citizens, 15 to 20% or whatnot. And that goes into universal health care, and then you don't have to pay anything when you go in, period. There are hybrid models where it's part of that, and it's part of federal, like the GDP. And so like just how they're funding the military or whatnot, then it's part of that. So people are not.
That's what I wanted.
You don't see it in your check as something that got taken out like we do for Social Security. In a way. Well, I think other countries do that differently. That's how we are dumb and do it. But I think other countries generate income because of exports or, things like that. And so, yeah. So the newest player to universal healthcare is Thailand. This century. They just got it started. 2002. Thailand.
Bangkok?
Yeah.
Okay.
And they're doing quite well with it.
You better check up under that skirt if it's real or not. You know what I'm saying? Before you get over in Bangkok.
And I bet you if you need to have transition surgery, they'll probably pay for it. As they should. Because it's a medical issue. Gender dysphoria is a medical issue. And it should be paid for.
Gender dysphoria.
That's right. I'm going to get totally blocked for that because they're hunting people down for saying that phrase.
Gender dysphoria.
Yes. So we'll say body dysphoria. Let's say body dysphoria. That's what we're going with now to be on the down low.
Are we still on TikTok?
But we know what we're talking about.
Watch her.
So if we streamlined our system and things were administratively smooth, there wasn't all this overhead, there wasn't all this prior authorization shit, there wasn't all these people saying no, and all of us having to write letters and all the rest of the stuff. You guys are crazy. You still talking about penises?
Yo, I have been to Bangkok. He's saying because you got to check him. I've been to Bangkok a couple times.
Yeah.
Yeah, all right. Don't worry about Eric.
Yes.
Fuck Eric.
You ended up with a beautiful trans woman.
No, I did not at all.
Sure you did.
At all. Anyway.
I think you should have. Yum.
No.
Pretty,
anyway,
feminine, wily, and a penis.
Eric,
bring it.
Eric, it's just for the sports show, Eric. This is for the sports shit.
That is a sport.
Oh, my God. All right, anyway.
Sex is definitely a sport.
So, at the end of the day, it's just sheer greed, huh?
It is sheer greed and power. I think it's both of those things, and I think they go along hand in hand. So estimates are if we took everything in this country and socialized it with universal health care, that within 2 years, we would save this entire country $450 billion, which means in the first decade that we employed it, we would make over $1.5 trillion back just in revenue spent, fucking around with paperwork, being inefficient, telling people no, and poor health outcomes. Because when your neighbor gets sick and can't pay for it, you still pay for it. And I think that's one of the things that people didn't understand about the Affordable Care Act was that they're like, this is socialized medicine. It was the same. Like, we are all under a semi-socialized care system anyways. And the ACA actually put a name to it and put bullet points on it and pointed out, this is what's actually already happening with people who are insured super well, people who are very healthy and paying for other people who are not very healthy.
Like Social Security, almost just.
Yes, it's the same freaking thing. But then people lost their minds and they're like, we're not Russia, which is communism, you idiots. But anyways, there was this whole thing about we're not Russia and all this like red hate. And
we seem to love Russia a whole lot, though. We seem to love Putin's ass.
Oh my God.
Epstein
sure, why
files.
not? Speaking of asses.
I think Putin got a little bit of some evidence on some people. Anywho.
Vlad, what's going on?
What's going on?
Give me the skinny.
Yeah.
what do I think the outcome is going to be of
Is it ever going to change?
it has to. It's 100% unsustainable.
How
I
do we-
might be watching from Uruguay, just saying.
How do we get there though? Like, let me first of all, before we go into that, because I want to get into that. How is the breakdown for you guys as doctors? How does the money matriculate down to you guys? And what is the process and how hard is it? And because we just saw that doctor talk about the runaround.
Mm-hmm.
How is it working for you guys?
It doesn't work at all. I mean, I will spend, okay, so say I see a patient for 30 minutes and I charge them $100. That's supposed to be $100 for 30 minutes, meaning I make $200 an hour.
Okay.
That sounds like a lot of money, right?
Yeah.
Yeah. So once I pay for overhead of office staff, electronic health records, paying for my own medical equipment, medical education, units that you have to have every year, licensing, like once you go through all of that, and then you have to document. And so your 30-minute meeting with me, I'm probably going to document and fight with pharmacies and write prior authorizations and make extra phone calls for a couple days, like an hour a day for a couple days. I don't know how much I just made.
How much does that $100
Pennies?
break down to at that point though?
Very little.
Shit.
And so, and if you're talking about like, so that's me with my telemedicine gig that I see people for like 20 to 30 to 50 minutes, depending on what we need to get done. If you're in like a regular old clinic going to your primary care provider, they are being paid by Medicare, which is the gold standard for insurance. Like whether you're in Cigna, Aetna, Blue Cross Blue Shield, any of those things. It's all, the standard is Medicare is 1. That's the unit. And so then other insurance companies are like, we will pay you 1.25 of Medicare, or we will pay you 0.85 of Medicare, right? So that's what the standard is. So if we just use Medicare across the board as a standard, they are paying doctors for 10-minute visits. That includes talking to your MA and getting all the vital signs, going over old charts, actually seeing the patient, documenting afterwards, writing prescriptions, ordering studies, making referrals, ordering labs. I'm sorry, 10 minutes? That's not even a real thing.
Let me get Craig. Let me see Craig. What Craig say here?
And so what happened in Bangkok stayed in, but well, not if it's the clap.
You done fucking got Eric. This is
Your fault.
Not if you got your hemorrhoids roughed up.
all right, Craig.
I got comments.
All right, I'm stopped.
I got the comments over here.
All right, yes, sir.
You want to read it again?
Fucking boys. That's what it is.
Oh yeah, malpractice premiums. Girl, you ain't even.
Oh, so that's that. So there's a ton of fees for you guys, huh? That shit made you giggle. No tickling. No tickling.
Oh, it
Whoa.
tickles
Oh boy.
like fire, like lava and fire. I think the last time I had malpractice insurance
They taxing you guys, huh?
in the emergency department, I was paying about $68,000 a year
What?
for malpractice insurance.
What?
Yeah. So like if my gross, right? Like if my take home, what I was expecting was 300 grand, let's just say, which it was never. You just took almost 70 grand in malpractice insurance that I didn't even use. I still need health insurance. So that's another, what? Probably 15 grand. Like, and it just keeps going. And so like your take home, it doesn't look very good. And so when you sign your contract going, oh my God, I'm going to make 300 grand, you are not even getting close once you pay for malpractice insurance. Now, granted, emergency medicine, anesthesiology, and OB-GYN, we pay the most in malpractice insurance because we are the ones who are sued the most. So other people are not paying quite that much,
Of course.
but it's still a very big chunk.
Can I ask a question though?
Yeah.
I want to know, how many fees do you have to pay? How many fees is it? What is like, you got malpractice? What else do you have to pay as a doctor?
So the group that I was in, we all paid for our own stuff. And honestly, like if you break it down in any other way, you're still paying for all your stuff. I mean, even if you are 125K in 1997. Yeah.
For malpractice? Is that what she's saying?
I think probably for fees.
For fees, total fees. Total fees was 125K?
Yeah, 30 years ago.
Damn.
So imagine what it is now. And yeah, he was a surgeon, so he was going to pay a lot of money. I think ours was actually a little bit less because our group did so well from a malpractice standpoint. And so I think overall malpractice insurance is actually quite a bit higher for most emergency physicians.
1 second. Hey, everybody that's on TikTok, the whole show is on YouTube. Please come on to YouTube, subscribe to Dr. Cari, for fuck's sakes, FFS with Dr. Cari. She has a telehealth company. Listen, we're putting it all out there today. We're talking health insurance, and this is interesting as hell. So salute to all you guys, man. We love you guys. All right, let's go. So
yeah, so you have to pay for, so I have 15 state licenses. That's thousands of dollars per year just to be licensed to practice in them. And I may or may not actually see any patients in that state.
That was the only for 125 for fucking malpractice in 1997.
He was a surgeon.
Shit.
There you go. And like I said, because I was in a large group that had good statistics and good data, we probably paid less per doc. But yeah, so you have to pay hundreds of dollars per year just for your state license to be able to practice at all. You have to pay for your DEA license so that you can prescribe. You have to pay your board certification and do all of the continuing education units, which is
every year,
hundreds of dollars per year. Every year. Yes. Every month you're paying for malpractice insurance, your health insurance. God forbid you have dental and vision, which I have never had since I got off my parents' insurance at the age of 18. I've never had dental or vision, so you just pay for that out of pocket. Yeah. And now you're paying for your EMR. You're paying for office staff to keep track of all the shit I just mentioned. And you want to pay them well because you want them to be on your side and to fight for you. And then most of us have to go through billing companies and we pay them top fucking dollar because they are the ones taking our charts and looking at our diagnoses and going after insurance companies and patients for payment. And so they're the ones who go over the chart and they list like all the stuff that you can actually bill for as far as your diagnoses, procedures, prescriptions, chart review, all the stuff that you did, and they amass that, and then they tell the insurance company, hey, she did all this stuff and we want $10,000 for it. And the insurance company goes, no.
So who battles with them? Is that the billing company? Okay.
And that's again.
And that's where you're paying top dollar for the billing companies to fight for you as Yo, you really have to love medicine. You really have to fucking love medicine, bro. For real. Like,
it's none of this.
God damn.
Yeah.
Now, let me ask you this. Did you know it was going to be this hustle before your love for this?
No. No way. Absolutely not. And it's gotten worse. Like, you know, I graduated from med school in 1999. So things were starting to get bad at that point with insurance companies, but it wasn't like it is now. I mean, I feel like my generation of physicians and providers have seen the greatest slide into the abyss in the history of us having health insurance. Because like it started kind of neutral, like, oh, that's a really good idea. And then it kind of got better and better and better. And then it kind of wasn't getting great. And now it's just planting like a tent stake.
Fuck.
And so no, physicians are not happy. We are not able to practice medicine the way we should be, the way we want to be, the way our patients need us to. Going back to the pharmaceutical companies and the, you know, insurance companies that you played, Jeff. All of that is totally true. All we do is fight. And so then you also have to have this office staff to fight with the pharmaceutical companies and the insurance companies who are denying everything to even attempt to get your patient what they need while you go see another person because you only have 8 minutes. Let's go. And so you have to pay a whole bunch of other people to be doing all the other stuff.
That's crazy.
And then they come by and they're like, here, sign this real quick. And you do, and it goes away. And like, it may or may not be successful. It is ridiculous.
Jeffrey, what do you have for us? You got anything? Listen, I want to say this. This is a total hustle. What do you think the remedy is here? What do you think the remedy? Well, in a perfect world, as a physician, what would be your idea to help the world in this situation right here?
I think that society in general.
In a perfect world, Cari. In a perfect world. In your perfect world.
In my perfect world, we figure out, we go and we talk to Thailand, who just did this. We go talk to all of the Scandinavian countries and half the European countries that have universal health care. We go talk to a bunch of Latin American countries. We go talk to Australia and New Zealand. We are not reinventing the wheel, people. This isn't new. This has been going on for a really long time.
And I want to say something. Our president was not at this meeting in South Africa with all the rest of the worlds and countries. He was not there.
Well, because they're killing white people.
Yeah.
Oh my God.
Yeah. So he wasn't there to help us better as a country to get more understanding and more education on how to fucking serve the people of our country.
That is not his objective. Are you new?
No, I'm not. I'm just saying he wasn't there.
He was not there because he does not care. Okay. That's not an objective of this administration at all. In fact, it's the opposite. But in the perfect world, we would spend a couple of years asking all of our friends, hopefully they're still our friends, what went right, what went wrong, how do you sustain this?
Taking the blueprint from somewhere else.
And like, we have so many resources, right? Go use your resources. Hello, Canada, right up above us, although they are totally not talking to us right now. I do not blame them at all. But we go ask them because it also behooves them for us to have better health care, right? Like if we are healthier, we're not screwing everybody over all the time and we're not going into their countries to do weird and nefarious things and crime is down. And we used to be, when we had an NIH and an FDA and all of that and CDC that was all...
Well, let's go through that. NIH, what is that? NIH?
National Institutes of Health.
Okay.
So all of these little acronyms I just said have been gutted. People, the entire world used to rely on us for our statistics, our research and development. They can't do that now. And so they're flying blind, just like we are flying blind, right? And we're not going to give hepatitis B vaccines to babies. Oh, really? So we're just going to let them die at the age of 3 of liver cancer? What the actual hell? Anyways, so my idea would be that we would go to our friends and say, we have a little problem. You guys seem to have fixed it. How did you do that? What were the pros and cons? What are the things that you learned from your experience? And then we fix our shit and we get everybody insured and we get all of the providers paid the way they're supposed to. And we get patients primary care and wellness and preventative care. And they can go to the emergency department for appropriate things, not 9 months after they're out of their antihypertensives and just had a stroke. Like, let's take care of each other like other people have been taking care of their populations for decades. But this tends to be this whole, before this was even a thing, yes.
Are we delayed a little bit, Jeffrey? Are we delayed?
Yes.
Okay. You feeling it?
Yeah.
All right.
But we are not reinventing the wheel. We're not inventing the wheel. This is nothing new. We just refuse to do it. And I think that the culprit is because there is a teeny little subset of people who are making billions of dollars on this. And they are the ones running this whole show.
And willing to sacrifice human life.
And willing to sacrifice, because the rest of us don't have any value. I don't know if you've noticed that, but nobody gives a shit. And so, yeah, like they don't care. They are able to pay for their own healthcare and go to the people that they want to see. And they just pay out of pocket. So why would they care about us? it's cruel. It's cruel. Yes, it is profiting off of people suffering. And
it's inevitable.
Yeah, we're all going to get sick. We're going to have injuries. Yes.
I just saw a picture today. I wish I had it. The different cancer type of the country. Like yellow to red. The United States was all red all the way across.
Nothing.
And it didn't used to be like that.
Damn.
We used to have very good health outcomes and quality of health. And like literally since 1990, if you chart that out about morbidity and mortality and access and quality of health, we just keep dropping and dropping and dropping. And now we are the lowest one of the developed countries.
And this is the reason why people are leaving our country and going other places for medical attention.
Or just leaving, period.
I fully believe universal health care would single-handedly address the addiction and mental health crisis in America.
Well, we were on the way to doing a fairly decent job with that, Caitlin, until Ronald Reagan. And then he came along and said, we're just going to shut everything down. We're not going to do mental health, and we're not going to do social services, and we're not going to do addiction services. We're not doing any of that anymore. And it's going to save the country a whole bunch of money, not realizing the outcome of having so many people with untreated addiction and mental illness would also mean that the rest of us suffer accordingly. You want your friends and neighbors and family to be healthy and well. And so by just all of a sudden showing a huge profit margin, like, oh, we closed all this stuff and, you know, the GDP is great and we made all this money and we cut the deficit of the nation at the cost of what?
Yeah.
Stuff happened.
Right.
Yeah.
You didn't have clothes. You didn't have food. No hunting done. Or whatever. If somebody was sick, that job wasn't done. Nobody else did it.
Yes.
They did it.
It takes a village, and our village is crumbling because we are not taking care of. Yeah, everybody's all self-absorbed and it's all about me. And it's like, it can't be. We live in a society. You're not.
I'm afraid that now that we're so.
Gavin Newsom.
Yes.
Gavin Newsom's going to fix it all. It's Gavin.
I know you've got some weird shit with Mr. Newsom.
Only Gavin Newsom's going to come in and fuck it. I just like he's an asshole. I like a good asshole, for sure. Who's this? I fully
You like a
believe
good asshole? Is that what you said?
You know what?
That's what I heard. Is that what he said, Jeffrey? Bravo. I say bravo.
I didn't say that.
I'm pretty sure
Said
that's what
that
you
shit.
said. I love it when you stutter a little bit. Good things happen.
Well, I'll tell you guys what. You got anything else, for fuck's sakes?
Oh, I was looking at, so these reports were generated
I did to myself.
over the last, well, I think it was like 2018 to 2023. And they were asking employees of, Caitlin heard it, she said, I love her. God, I can't wait to have wine with you.
All right.
They were asking people who had employee healthcare, sponsored healthcare. And they reported almost across the board that once they were on employee sponsored insurance, they were less likely to have a primary care provider than before. They were more likely to experience insurance instability, meaning we don't know what they're doing for us. Your pharmaceutical issues, it changes every January. The price keeps going up and the coverage goes down. We don't know who's in network and what's covered, all of those things. They had 2 times more difficulty to see a physician at all. They were more likely to skip or ration their prescriptions. So they had already finally seen a physician, gotten prescriptions, but can't afford to take them as they are being prescribed. We prescribe medication in the way that your physiology needs to absorb it and metabolize it. So if you're skipping or rationing, It's actually, you might as well not even be taking it. It's typically. They were 3 times more likely to have medical debt. So not only do you not own your home, but now you have medical debt, and it's through your employee, or it's through your employer. So now you owe them more money too. Like, I don't know if anyone wants to go back to like slavery and stuff, but you know, that's what was happening. They were way less satisfied with the care that they got once they got it. And the other problem is that our system, without being universal, is not portable. And so if you have Cigna, you have Cigna of Nevada or California or Wisconsin. You do not have Cigna
of America.
Correct.
Heaven forbid
Twist the ankle somewhere and got to go to the doctor, huh?
Exactly. And being so close to the border as we are here, that comes into play a lot, because people come over from California who just lived 25 minutes from here, and now they don't have coverage. And they don't have any providers. You know, kids that are on a road trip, or your grandma comes for Christmas and she doesn't have her medication.
It don't work in other, it's not.
I mean, your coverage is.
It does if you're in the VA or you have Medicare. Oh, what? Magical fairy dust, where it like floats everywhere with you the way it should, because you still have the same stupid body. Oh my God.
Damn.
And so, yes, if
you gotta get hurt right here. If you get hurt, motherfucker, get hurt right here.
Oh, yes.
Don't get hurt somewhere else.
Stay local, or else it is going to be a whole situation when the bill comes through, because your insurance is going to be like, we don't cover you when you're skiing in Montana. I guess that's on you. What? How does that make any fucking sense at all, right? Also, systems don't communicate. Like, if you are a Kaiser patient and you are in Nebraska where there is no Kaiser, nobody wants to help you. If you have insurance through like the Sutter healthcare system and you get 90% of your stuff done, and you get hurt out of state where there's no Sutter, and you go, I don't know what my medications are, just look it up. They can't do that. We can't do that. So in Reno, one of the main hospitals, the main hospital in town, is a quarter of a mile from the VA. The VA has very limited resources here. They do a great job with some stuff. They cannot do anything on other things at all. So we get VA patients all the time to Renown. Brand new VA, amazing, beautiful, but still understaffed and all of the things. So VA patients end up getting transferred to us all the time, or the VA patient has already gone to the VA and been denied a couple of times, and they just know they don't need to go there. They need to come to Renown. We don't have any of your records. So when you tell us like, oh, I don't know, I'm allergic to like this small yellow pill.
What a flawed system.
We have no idea what you're talking about. And it's going to take between 2 and 7 hours to get your records bicycled to us a quarter of a mile away.
Crazy.
To make sure we don't give you something you are allergic to. What? What's happening? Like, should we just do this by pigeon carrier? What the actual fuck? And so you have to that's why you have to have your stuff in your wallet or your purse or your phone. Like, have pictures of your medications, of your insurance cards, of your allergies, of all the surgeries you've had. You have to bring all of that with you, because the systems do not talk to each other. And people don't understand that. They're like, I was just in the hospital 2 days ago. I'm like, you weren't here.
They know how to take your fucking money, though.
Oh, yes.
Right?
Somebody in the billing company will definitely be contacting you. Right. Right.
Battleborn says,
but they will send you a CD of your documents and images. Who the fuck has a CD reader? Girl, I'm telling you, it took Renown like 12 years to stop that. Just stop it. And I would say print them out. And like, you know, where you see people like with the dark images and they shove it up on the wall with the light box. We were doing that for so long because I'm like, do not send a CD. Nobody has a CD reader, or they don't have the app to open it. Like, stop it. We don't even need those anymore. Knock it off. Nobody can see those. And so it's easier to like friggin' take 20 pounds of your stupid images to put on a light box so that the doctor who sees you next can actually look at them. There's no, like, never before have we been able to communicate in so many different ways, so easily, so immediately. Remember when the fax machine was like the most amazing shit ever? Right? We're still using the, shut up, Jeffrey. He doesn't remember when the fax machine was.
Okay. Yeah. All right, cool.
Oh, I'll come after you later.
It made a lot of noise. Trust me on that shit.
Yeah.
Yeah.
And so we still use fax machines because sometimes it's the fastest way to talk to each other. But then you have to like have a human over there to go over the fax and like look at it and then get it to the person that it's supposed to. Do not trust that your providers and your healthcare systems and your hospitals can talk to each other.
Is AI going to take control of this?
Not unless the healthcare systems can talk to each other. It is literally illegal for the healthcare systems to talk to each other. All of it. Like, so then you have to go in and hope that the patient is able to sign a piece of paper to release their medical records.
Really?
And then you send it, usually by fax, sometimes by DocuSign or email, and you hope that someone on the other end gets that piece of paper and decides that they can read it. And then they have to go into medical records and go get it and then send it. It's absurd. Whereas if we had universal health care, we'd just be like, do. Oh, there we go.
Why is the fax still the most HIPAA compliant?
It isn't. It never has been, because anybody can walk past a fax machine and pick up the fucking piece of paper. Yeah. I mean, come on. It's not. It never has been. But it's the best that we've been able to do, which is absolutely pathetic.
Well,
I don't have a lot of good news today.
No.
As a person that's not a doctor.
Right? Regular person society. All right.
Non-medical person.
Right. Non-medical.
I don't think you should feel encouraged. I think
I feel like
I think you should be angry and scared.
I don't feel like we had any redemption here for this podcast. I feel like it's just doom until we get something better.
I think I mean, it may be a grassroots uprising that has to do away with this whole fuckery.
Well, my final question is this. Do you see this ever getting better? Do you see us ever getting to a better place in this world? In our country, rather. Because obviously the world's picked up on it, but in this country, do you see us getting to a better place with a new regime, what do you see and what are your hopes?
I think that 10 years ago, I had a lot more hope that Medicare would be better. Socialized medicine would be more widespread. And I felt like the ACA/Obamacare was the first step away from the disintegration of the system. It was not going to be the end all be all. Like, you can't fix, half a decade of fuckery overnight with one policy. That you have to try something, right? You have to implement something, and then you have to find out what works, what doesn't work, tweak it, go back to the drawing board, tweak it again. I thought that's what was going to happen with the ACA. That is not what has happened, because
I don't understand.
I think that there was a lot of blinding because it was such a politicized determination. And I think because we have gone, like, the shift is so far, and the ACA, it seems like the devil now. And I think that we have gone so far away from the tweaking of that implementation that we're almost starting from a worse position. And so people don't want to tweak the ACA because it hasn't been working very well, even though like 45 million more people are insured now today than they were before the ACA was implemented. That's a lot of freaking people who are insured to some extent, who simply didn't have any insurance before then, which is worse, right? If you're completely self-care, like you could have a cold and lose your apartment. And so we are, in my opinion, we are further away than we were 12, 15 years ago. Oh yeah, many steps back. And so now I don't know if I'm going to see that in my lifetime, right? Like, I feel like it might take more than 4 decades to figure this out.
Well, we had a very successful podcast tonight. I don't have any.
Why do I have a month? What I want in my insurance.
I don't
Why
have
can't
any.
I do it all year long?
I don't have any positive outcomes on how this works out, but
Why do I have to only have between May and June change that?
Right. The open enrollment thing is so strange to me.
I live the rest of the year.
and it's a scramble.
It is
such a scramble.
Yeah. Like everybody has a panic attack on December 1st because like, oh my God, by January 1st or whenever it is for you. It's that is such a weird thing. Like, why can't you on April 22nd be like, hey, I got this thing that's going to be happening. Yeah. Like you shouldn't have to get married, have a kid, or die to change something.
That's a whole other conversation.
Oh yeah. For real.
Listen, I want to say for fuck's sakes, man, it's been another beautiful Sunday of medicine talk. We talked insurance tonight, health insurance tonight. We're back, Dr. Cari, for fuck's sakes, and it's been amazing. We have no great outcomes on this. We pray for a brighter future.
Please.
And we love you for fuck's sakes. Salute to you guys. Thank you guys for hanging out with us.
Yay! The rest of it sucked.
That was good shit.